Hi, and welcome to our career training series. I'm Nick, and I'm one of the team members here at myCNAjobs. Today, we'll be talking about preventing falls when working as a caregiver and CNA. Caregivers and CNAs work with many patients who are at a higher risk of falling. This includes the elderly and those who may become disoriented or confused, like patients with dementia. Falls are one of the leading causes of death in the elderly population. As a caregiver or CNA, it's your job to help the patient remain safe, and preventing falls is a big part of that. How do falls happen? Well, falls can happen in many ways. It could be as simple as someone slipping as they try to get out of bed or step into a shower. Sometimes medication can cause vision issues or dizziness, which causes a patient to lose their balance or misjudge a step on a flight of stairs. Here are some steps you can take as a caregiver or CNA to help prevent falls. Assess the environment around the patient. Look for things that can increase the risk of falling for your patient. Poor lighting, something on the floor or in the way, poorly fitting or improper footwear, and unsturdy assistive devices, such as walkers or canes, are all things to look out for. Make the necessary adjustments. This may be turning on another light so your patient can see better, moving something out of the way, or stopping patients to make sure their shoes are put on properly before beginning to move. Know your patient. Take note if they have any factors that could further increase their risk, such as medications they're taking, or if they've fallen before. If you're working with multiple patients, understand which are at a higher risk of falling. Be proactive. Falls often happen when a patient needs to use the restroom or is trying to reach something not nearby. If you can be proactive in checking in to make sure their needs are met, this will help reduce their risk of falling. Restraints. Some facilities use restraints to limit patients' movements so they're less likely to fall. If this is the case for your patient, always refer to the policy in place where you're providing care and follow it carefully. Never use restraints unless an order is given by the appropriate person on staff. What should you do if a patient does fall? Well, first, look for any injuries such as bleeding or any apparent breaks or dislocations or a change in mental status. Then call for help as soon as possible. Next, notify your direct supervisor. And finally, document the situation carefully. Take note of your patient's condition and the environment around them. Well, that's the end of today's lesson. If you're looking for work as a caregiver or CNA, you can visit www.myCNAjobs.com to find a job near you. Or if it's easier, you can call and talk to a recruiter directly.